Mr. Buckle, your story reminds me of one that I've told a few times. A family that actually did have to file for bankruptcy before the Affordable Care Act was law. Back before the Affordable Care Act was law, about 1.5 million people every year filed for personal bankruptcy. I don't know if Senator Baldwin just used these statistics. And we knew at the time that about half of those, more than half of those, were because of these medical debts for people who were exactly in your position, Sam. And today that number is 750,000. That's a 50% decline in the number of people who file personal bankruptcies. And there's only one reason for it: the Affordable Care Act. There's still some people that get into the situation that you're in, but there are hundreds of thousands less people because they have access. And that's astonishing. There's very few pieces of legislation that we pass that have that big an impact, a 50% reduction in the number of people who file bankruptcy in this country, and we're putting it all at risk. The Bergers from Meriden, Connecticut have a unique story. This is before the Affordable Care Act. They were on the husband's insurance their entire life. Husband switched jobs. 1 week he was without insurance. One single week. Guess what happened during that week? Son got diagnosed with cancer. And it became a pre-existing condition that the new insurer would not cover. And you know what happened to the Bergers? They lost everything. They lost their house. They lost their savings. They lost the kids' college fund. They went bankrupt because of the misfortune of a diagnosis occurring in the 1 week, the 7-day period of time that they didn't have insurance. That's a unique story, but there are 750,000 unique stories that now have protection because of the Affordable Care Act. Ms. Price, I wanted to ask you a question. When you're 25, 26 years old, were you planning your life with the expectation that you were going to have to deal with a cancer diagnosis in your 20s?
When I was 27, I was planning a lot of things. Cancer was not on my radar at all.
So you're not 26 anymore, but take us back into your head in your 20s, because what we're dealing with now are two assaults on one of the foundational ideas of the Affordable Care Act, that everybody should have insurance and that it actually benefits everybody when healthy people and non-healthy people have insurance, because it balances out the costs. So the Congress ripped out the requirement that individuals have insurance from the Affordable Care Act. That's going to result in 13 million more people having no insurance. And then these short-term plans give you the illusion of insurance when you really don't have it. And the worry is that a lot of people in their 20s who are feeling like they're healthy are going to either say, I don't need insurance, or are going to be attracted by these low premium policies that have no insurance because they feel invincible. You probably felt pretty invincible in your 20s. What's the risk here from your perspective about sending a message to young people that they either don't need health insurance or they'd be fine with one of these junk sham plans?
Yeah, I mean, when you're in your 20s, 30s, you are healthy. You're not supposed to get cancer. You're not supposed to do anything. But anything, you could break your leg. That requires a significant chunk of ER time. When you're in your 20s and 30s, you aren't supposed to get sick, but you do. Some people do. 80,000 young adults between ages 15 and 39 are diagnosed with cancer every single year in this country. That's just cancer. Right. There are a number of other conditions that befall people in their 20s and 30s. And if you're in your 20s and 30s, you probably don't make a lot of money. You're starting your career. So it's even more devastating when you're hit with financial troubles and medical bills because you don't have a savings account to pay for it. You don't have a sizable 401k you can dip into. You may or may not have family that can help with those. So, you're in a precarious financial position. You're trying to build your life. You're trying to buy a house. You're trying to plan for kids. You're trying to plan to get married. And all of a sudden you are hit with hundreds of thousands of dollars in medical bills that, if you're lucky, will be covered. If not,
good luck.
Yeah.
Yeah, and listen, it's somebody pays. So in Sam, in your case, either you're going to spend the rest of your life paying for something that was not your fault, or those hospitals that aren't getting paid those bills are going to find some other way to get recouped that money. They're going to jack up charges on somebody else in order to get that money back. So it's not as if somebody doesn't get hurt here, even if the bills don't get paid. Insurance is this miraculous way to spread the costs out over the largest number of people possible, rather than burdening one person or a small number of people. I want to just ask one more question, and that's to you, Dr. Bowen. You had an interesting example in your testimony of somebody who had something really awful happen to them because they didn't have insurance. But I imagine you run into a lot more people now, especially after the Affordable Care Act, who have some really important things happen to them because they have coverage, conditions that you notice early on, that you can get treatment for early on, that don't end up turning catastrophic or can be managed later on. I'd love for you to just share maybe one example of, it doesn't have to be somebody who's insured by the Affordable Care Act, but what does it mean in your line of work to be able to catch something early in their 20s? What's the difference between having preventative coverage versus having to wait until it becomes a crisis to deal with it in your line of work?
It's huge. As I tell my patients who are not pregnant, nobody goes into pregnancy to get a better body. So things happen. There are risks. We know that, for example, 5 to 7% of women, when they become pregnant, will develop diabetes. That's something that we can manage. So we can manage those patients. We can get them on medication if necessary. We can control what's happening so we don't end up with a huge baby or we don't end up with complications otherwise related to the diabetes. We can identify medications that women should not be on. We can do so much troubleshooting. It makes all the difference in the world to know someone has developed high blood pressure, someone has a health problem, they have clotting issues, and we need to put them on medication. Maybe they have risk for preterm delivery, and we can give them medication to prevent preterm labor. When things happen in obstetrics, it's fast. We don't have a lot of time. When a patient starts to bleed, we can lose a lot of blood in a short period of time. We need to anticipate that we have a patient who might bleed, who has complications, has placental issues, has clotting problems. So we could manage her care. We can give her the medications. We can get her the team that we need to have available so that when she comes in the door and she delivers, we're ready, we're prepared. We're going to give her and her baby and her family the best outcome they can get.
Thank you for holding this hearing. I'd love for the people who support these short-term plans to sit down and read a statement of benefits, right? I'd love for all the people who think that folks who are signing up for health insurance are, just going to be smart consumers and be able to weigh the benefits of one versus the benefits of the other, to actually sit down and see if they can understand the fine print of these junk plans that are in the business of trying to make you believe that you're getting coverage when you're not getting coverage, especially if you're in your 20s thinking to yourself, I'm never going to need this. Then all of a sudden you get pregnant, you have a complication, and you need it. I'm in the business of doing healthcare policy, and when I sign my family up for the exchange every year, it is most of what I'm reading is Greek to me, never mind to the folks that we are now asking to aggressively shop around, given that the protections that we all put into the law to make sure that insurance are being eviscerated. So I went way over my time, but thank you, Senator Stabenow.
Well.